Hi, I'd just like to introduce myself. My name is Dr Stavros Mihaletos. I'm a doctor of chiropractic practicing in the East Midlands in England. And I have a clinic in Ashbourne, near the Peak District, and in Belper as well. Just want to tell you a little about myself. I have a long history in martial arts. Did a style of martial arts called Tibetan White Crane and Aikido. I'm a lifelong practicer of Qigong exercises, which is, in a sense, I suppose you could say, Chinese yoga. And this has basically shaped a lot of my ideas about health and strength in body movement. In time, I became a chiropractor. I've also done a little bit of Reiki and some of the sort of background courses in healing as well. And that has shaped me to where I am today. So I would say that all that I keep in a sort of toolbox available to me when I treat people. With chiropractic, it's really, I find, very profound, because you are always looking for a primary cause to the body's compensation. So when you have the body standing up in complete alignment, let's say in a non-gravity environment, you would be able to maintain that state. But I think for all of us, every single human being, every one of our monkey bodies takes strain, even just from gravity or from keeping alive. And that's what we treat, right? So you can be as healthy as you like. You probably would benefit from chiropractic treatment, or you could be in severe pain. And I'm talking about, obviously in this case, musculoskeletal pain, because you wouldn't come to us with, you know, anything more severe than that. Sometimes, however, we do find that. And as doctors of chiropractic, we are trained to recognize any visceral or organ problems and then refer you to specialists in those areas. Personally, I like to refer to functional medicine practitioners, because we find that functional medicine tends to treat, again, the cause or the source of an organ failure or an organ disruption. So what you'd rather do is, rather than numb the symptoms, which is what our current medical paradigm does, what we're trying to do here is find the common source or the ultimate source of a problem. So let's take, for instance, a case of what I found in the past with a belly ring, okay? And, you know, Simon King, Matthew Pigden, they've done fantastic work on this type of thing, and I've learned primarily from them. When you have a belly ring, for some people, this can cause a withdrawal reflex with the gut. So what happens with the withdrawal reflex is a bit like pulling your hand off a hot stove. You tend to tighten up the tummy muscles, and then obviously all your back muscles will relax. Yin and yang, that's what happens. And once your back muscles relax, you go and pick up a piece of paper and your back goes. So it might be the belly ring, it might be something caused by somewhere else in the spine, but simple little injuries like that tend to have a history that preceded them. And that's what we look for with chiropractic. So we give a manual manipulation or a spinal manipulation into the vertebrae in the body that releases the muscles that are holding those vertebrae tight for an old reason. And once those muscles are released, the body generally starts working, unless there's something else you need to find. But the body starts working perfectly as far as reflexes are concerned, okay? And that's what we're looking for. We're looking for a better, more robust muscle tone in the body, a stronger ability for the body to react to its environment. It's a fantastic, powerful therapy. I recommend it for everybody. So if I can be of any help to you, I'm at Ashbourne Chiropractic Clinic, I'm at Belper Chiropractic Clinic, and we basically serve the whole Peak District, Derby, Nottingham. I've got patients even coming from as far up as Sheffield. So just let us know if I can help you. Thank you.